European nations, with hospitals admitting 8 COVID-related patients a week per 100,000 people, 6 times the rate in Europe. According to the Times this morning, the UK now has the most new cases of any country in the world, though there will always be some caveats around testing levels. Some scientists have said that small measures like social distancing, mask wearing and working from home could be a simple way to bring down those numbers. Dr. Zubaida Haque is a founder member of the independent SAGE Group, and we can speak to her now. Good morning to you.
Good morning, Stig. How are you?
Very good, thank you. How worried are you, we all be by these numbers?
Oh, extremely worried. I mean, it's phenomenal, really, because since July, since reopening, we have been at extremely high cases in contrast to our European neighbours. And actually, at that time, they were quite high as well. But what they've done is, as well as rolling out vaccine, they've also had what I call vaccine, or what we all call vaccine plus approach, which is making sure that as well as rolling out vaccines to everybody, and as well as slowly rolling out boosters, and as well as vaccinating their teenagers, which they did over the summer, they've also had other things, other protections, public protections like face masks, ensuring ventilation, vaccine passports, all to ensure that we don't compromise our vaccine programme. And we've done the absolute opposite.
And do you think we are compromising our vaccine programme? Do you think we have a waning immunity problem at the minute? That we did a very successful vaccination almost a year ago, and therefore we'll see a bit of waning immunity. Do you think that not only there's behavioural issues, there's also issues of now the speed of the booster vaccine and vaccinating children?
Well, yes, and it's the perfect storm that will ensure, I think, that at the rate that we're going, that we're likely to compromise it. I mean, yes, we do have waning immunity. We have waning immunity for all those people that had their, vaccines right at the beginning, who are vulnerable to start with, which is why they had their vaccines, why they were prioritised for their vaccines, especially those, who are also immunocompromised and who have other at-risk factors, if you like. So certainly for them, there's waning immunity. We know also with AstraZeneca vaccine that it's not as effective in terms of transmission and infection, with the Delta variant in particular. It's not as effective with this variant. And that's the thing that we have to remember, is we are dealing with a completely different beast now. The Delta variant has shown itself to be a dominant variant because it is so transmissible, and it's affecting children in particular, and it's ripping through children. And quite honestly, Stig, I'm so angry at this government for not having vaccinated our children over the summer. And it just feels like they've just, they've given up on everything. Their approach isn't scientific. It's not protecting vulnerable groups, and it's certainly not prioritising educational children's health at the moment.
But could this be part of a plan, though, that we still have mild weather in this country largely at the moment? They did suggest early on they wanted to try and get some of the wave earlier rather than later. Is it possibly a good thing to have a certain amount of infection going through schools, because most children won't be very ill affected, to happen now in August, September, October, because that's better than it happening in December or January? Is this part of the plan to get some of the infection earlier in the season?
Why would you get it earlier when you've got a vaccine? Why would you even have that plan? Yes, let's do it earlier rather than later, when you can suppress it, when you've got all the measures. And we know we have those measures because it was only back in June that we were much lower. Last September, because of the measures, and we didn't have full lockdown then, we had significantly lower cases, and more importantly, Stig, we had significantly lower hospitalizations and deaths. At the moment, it's like 1,000 deaths a week. It's almost 1,000 hospitalizations a week. And last year we were looking at probably 100. It was just so much lower. And we know we've got those measures. We know it doesn't have to be, open or close schools, lockdown or no lockdown, that actually, and our European peers are doing this, that if you have good ventilation, and it is possible, you can have more sort of easily ventilated buildings with, more HEPA filters and so on. If you have ventilation, if you have face masks, if you still have physical distancing, you still encourage people to work from home if they can, that actually it's possible to bring it all down. So it's a crazy, crazy approach to say we'll do it earlier, because people are still dying if you do it earlier. And at the rate we're going, we're looking at 40,000 deaths a year, which is utterly unacceptable.
Susan texted in and there's a certain amount of scepticism, I think. There's a certain amount of people thinking it's all over now. Let me read this out to you, Susan. The fact there are 45,000 cases of COVID last week means nothing. The majority of these are kids who have either no symptoms or very mild symptoms. Please stop scaremongering and get some perspective. This wasn't towards you, this was towards us. How about addressing the huge number of untreated cancers? There's a view that these cases aren't bad cases and therefore we shouldn't be worried about this.
Well, I mean, so I'm sorry to say that it's just completely wrong. The notion that infections don't affect children and that it's mild, yes, children are less likely to die from this, virus. But no, it doesn't mean it doesn't affect them. We've got over 200,000 children, well over 200,000 children off school. At the moment, we have the equivalent of 2 children in every secondary classroom and 1 child in every primary classroom. And that's excluding their contacts off school. We've got hundreds of thousands off school. And on top of that, we've got 50,000 children with long COVID, and we know that that's a chronic disability. We know that a lot of those children have been off school for over 3 months. And, just on Friday, we had an 11-year-old come on Independence Age who's been off school for months and months and months because of long COVID. It's not mild. And we know also that, we've got approximately 1,000 children being hospitalised per month at the moment. We've had about 100 children die in this pandemic. Nobody talks about that. Nobody talks about the children who have died with COVID. So it is not mild.
Dr. Zubaida Haque, thank you so much for joining us this morning. She's a founder member of the Independent Sage Group, and saying that she's very concerned about the perfect storm awaiting us, and people should be conducting themselves in a certain way, wearing masks, not gathering indoors, being careful. It's not a question of being locked down, but just recognising that the illness is still out there. You can let us know what you think of that. 87222, start your message with the word Times, or tweet us at Times Radio.
Or you can email